Hello, and welcome to today's town hall, linking MSDs to total worker health. My name is Corinne Towler. My pronouns are she, her, and I serve the National Safety Council as director of the MSD Solutions Lab. I'd like to express a huge thank you to everyone in our audience for your leadership in actively seeking to transform workplace safety and reduce the risk of musculoskeletal disorders for your employees. Before we dive into the heart of today's content, we'd love to hear from you during this event. So if you have questions, please submit them using the Q&A function at the bottom of your Zoom screen, and we will do our best to answer those during the Q&A portion at the end of the hour. In a few moments, you will hear from Dr. Alysha Meyers, an epidemiologist at NIOSH, who will share key insights on ergonomics and the total worker health approach. Then we'll transition into a conversation on how the total worker health framework can help an employer prevent MSD injuries and the elements that every organization should consider to develop a total worker health program for themselves. We'll take our audience questions at the end of that session. And last, I'll wrap up our event, highlight new resources and upcoming events, and close promptly at 2 p.m. Eastern. Before I pass the mic to Alysha, let me share just a bit about the National Safety Council MSD Solutions Lab. It's a first of its kind strategic initiative funded by Amazon to research or to reduce workplace musculoskeletal injuries by engaging stakeholders, conducting research, identifying solutions, and scaling the results so all workplaces can benefit. One of the key initiatives is our MSD Pledge, a global movement across industries to transform workplace safety and reduce the risk of musculoskeletal disorders, which are the most common workplace injury. And with that, here is the MSD Pledge. As you see, by signing the pledge, organizations commit to analyze the causes of MSD injuries and invest in solutions and practices which reduce risks to workers, leverage best practices and share learnings to improve safety practices, build a culture of safety where everyone at every level is accountable for safety and health, and of course, the overarching goal, working together to reduce MSD risk and resulting injuries across the entire collaborative pledge community by 25% by the year 2025. Together, we're creating safer outcomes for millions of workers worldwide. Signing the pledge is free. Organizations that take that step gain access to a wealth of resources to advance their safety programs. Visit nsc.org/MSD Pledge to learn more and join us in this important work. Since the launch of the pledge in June, our community has grown to over 135 MSD Pledge member companies, employing more than 2.5 million people across diverse industries. We have the honor of having organizations like Aero Wrecker Service and Ergo Plus to First Transit and True Value Company as part of our community. Please consider this your invitation to join us if you have not done so already. We're excited for today's town hall to help you learn about how the total worker health approach can contribute to a safe, health-enhancing, and fulfilling work environment. Now, I'm so pleased to welcome Dr. Alysha Meyers, an expert epidemiologist and ergonomist dedicated to promoting musculoskeletal health. She has been with the National Institute for Occupational Safety and Health, fondly known as NIOSH, since 2010, and with the NIOSH Center for Workers' Compensation Studies since its inception in 2013. Her research interests include using workers' compensation data for occupational safety and health, preventing work-related musculoskeletal disorders, and total worker health. Dr. Meyers is also the current NIOSH Program Officer for the Upper Limb Musculoskeletal Disorder Consortium to prevent work-related upper limb MSDs. Dr. Meyers, welcome, and thank you for being here.
Thank you, Corinne, and thank you for having me. Today, I'm just introducing our topic briefly by covering some terms for the discussion later. And I understand that for some people today might be your first introduction to total worker health, and for others of you, you might be experts. So both ergonomics and total worker health do use a systems approach and have similar hierarchies of controls to prioritize efforts to prevent work-related MSDs and to enhance overall well-being. So work-related MSDs involve the tendons, nerves, joints, and circulatory system. They've been given many names over the time, and you can see some of them listed here, like repetitive strain injuries, or RSIs, cumulative trauma disorders, or overuse syndromes. And all of these terms really broadly describe the nature of work-related MSDs. According to the World Health Organization, work-related diseases like MSDs are multifactorial, meaning that numerous risk factors cause them. In contrast, occupational diseases have a direct cause-effect relationship between the hazard and the disease. For example, black lung disease. And that's why we call MSDs work-related. Now, as an epidemiologist, personally, I do want to mention that MSD case definitions can really vary a lot in terms of their inclusion and exclusion criteria. And my point is really to say that not everyone here means the same thing when they use the terminology that you see on the slide. And sometimes this can cause confusion. So I want to emphasize that in my work, I always define work-related MSDs using a combination of clinical nature of the disorders themselves and the events or exposures that cause the injury. But whether these traumatic soft tissue injuries are included, such as strains or sprains, in the case definition can really vary among researchers or practitioners. And even in my own work, sometimes I include them and sometimes I don't. So in ergonomics, we do always exclude hard tissue injuries like fractures, and we exclude musculoskeletal symptoms or disorders that were caused by exposures that are not physical risk factors for MSDs, such as slips, trips, or falls. Next slide. So work-related MSDs are primarily caused by exposure to physical risk factors. There are also psychosocial and personal risk factors for MSDs. And as occupational safety and health professionals, our main responsibility is to fit the job to the worker by finding ways to reduce workers' exposure to physical risk factors. A total worker health program goes beyond this. It goes beyond programs, practices, and policies that just protect workers from traditional occupational safety and health hazards. We'll talk more about that in a second. Next slide. But today we're talking about ergonomic programs and how they fit within a broader total worker health approach to overall worker well-being. And this interdisciplinary field of ergonomics is really about fitting the job to the worker rather than fitting the worker to the job. And according to the NIOSH Elements of Ergonomics Programs Primer, ergonomics programs are a systematic process for identifying, analyzing, and controlling workplace risk factors, often for reducing MSDs. Next slide. So ideally, ergonomics programs are used as part of a comprehensive suite of occupational health and safety programs, practices, and policies. And for example, you can see one approach on the screen here. This would be designing and implementing an ergonomics program by following these 7 steps. It's in the primer I mentioned briefly. From the beginning, of course, you need management commitment to the program. So start off with identifying risk factors, followed by involving and training management and workers, collect some health and medical evidence, implement your ergonomics program, evaluate your ergonomics program, promote worker recovery through healthcare management and return to work, and then maintain that management committee commitment and employee involvement. So this is a systems approach for ergonomic programs. Next slide. Hopefully this is familiar to a lot of you. This traditional health protection approach uses hierarchy of controls to prioritize options for reducing risk. This inverted pyramid emphasizes using the most effective methods and the best business value for reducing risk by starting at the top of the pyramid. And then each level of the pyramid is ranked from most effective at the top, elimination, to least effective at the bottom, personal protective equipment or PPE. So elimination means physically removing the hazard, followed by substitution, which means replacing the hazard. After that, engineering controls can be used to isolate people from the hazard. The least effective controls are administrative controls and PPE, and my dog agrees. Administrative controls are policies that change the way people work, such as scheduling changes or task rotation. Next slide. So now we transition to total worker health. The definition is what you can see here on your screen. It's policies, programs, and practices that integrate protection from work-related safety and health hazards with promotion of injury and illness prevention efforts. And all of this is to advance worker well-being. So it's a strategy for integrating protection and prevention. Next slide. I want to emphasize that first and foremost, total worker health is about keeping workers safe. And then we simultaneously and comprehensively integrate the workplace policies, programs, and practices that grow health. And by addressing the whole worker, we can create worker well-being. So we're modifying risks, supporting and protecting workers, and advancing and promoting well-being. Next slide. So an integrated approach includes links across systems, such as the systems for enhancing well-being, employee benefits, safety and health programs, and even human resources. Total worker health broadens worker safety and health efforts to include other factors influencing health risks, both on and off the job and in the US economy. Total worker health offers a holistic, comprehensive opportunities for higher quality work, safer work, and better designed work. And this includes looking at really complex, multifaceted systems and approaches to worker well-being, the organization of work, and workplace exposures. It focuses on evidence-based research and provides practical solutions for employers and workers. So total worker health advances practice, policy, and the capacity for improved worker safety, health, and well-being. Next slide. There are three key tenets to the total worker health approach, as you see here. First, the approach examines how work organization and work itself can holistically influence worker safety, health, and well-being. Second, the approach embraces voluntary participatory interventions, just like ergonomics. Third, total worker health programs should protect workers' rights and privacy. Next slide. I also want to be clear that the total worker health approach is not these three things. It absolutely is not a way to blame the worker. Total worker health is inconsistent with workplace policies that would discriminate against or penalize workers for their individual health conditions or create disincentives for improving health. Total worker health is about integration and a more holistic approach. It is not a workplace wellness program that is just implemented without also providing safe and healthful working conditions. Next slide. So this is the hierarchy of controls applied to total worker health. You can see it's very similar to the one I shared earlier. And this is a companion to that traditional hierarchy. It is not meant to be a replacement for the health protection model. If you look at the very bottom, the brown tip talks about encouraging personal change. This is really the absolute bare minimum that an employer could do to improve workers' overall well-being. Ideally, you still want to focus higher up on the levels of the chart. For example, as before, the best solution is to eliminate threats to safety, health, and well-being. After that, develop substitute policies, programs, and practices with health-enhancing alternatives, or redesign the work itself to enhance safety, health, and well-being. Next slide. So I want to thank you so much for your attention. Here are some links to help you connect with the Total Worker Health program. And next, we'll begin the panel discussion. Next slide. And back to you, Corinne.
Awesome. Thank you so much, Alysha, for taking us through that overview in the presentation. We often talk about looking at injury risk reduction holistically, and total worker health is clearly a highly valuable framework for doing just that. Now, to lead our panel discussion is my colleague, Lisa Brooks. She's the North American HSE Networks Director at NSC and has over 25 years of experience in health and safety. Welcome, Lisa.
Thank you. Thank you so much, Corinne. And thank you to everyone for joining us today. I'm actually very excited to lead this next conversation. So we're going to discuss how a comprehensive MSD risk reduction strategy fits into a total worker health approach and improves worker safety, health, and well-being. So I am pleased to welcome back Alysha for this conversation, but she'll also be joined by two additional experts. Both have decades of experience in occupational health and safety. I'll quickly introduce them and then we can get into the conversation. So first, I'd like to introduce Dr. Jack Dennerlein. He is a professor at Northeastern University Beauvais College of Health Sciences and an adjunct professor of ergonomics and safety at the Harvard T.H. Chan School of Public Health. Additionally, he is the associate director for the Center of Work, Health, and Well-Being at Harvard Chan School, one of only 10 NIOSH centers of excellence for total worker health. We're also joined today by Dr. Emily Huang, an associate professor within the Oregon Institute of Occupational Health Sciences at Oregon Health and Science University, or OHSU. Now, during her more than 20 years as an occupational safety and health researcher and consultant, she has published extensively and was named the most prolific contributor to safety climate research over the past 38 years. So Jack, Emily, and Alysha, thank you for joining us for this next part of the conversation. But before we dive in, I do want to remind all of you attendees that you can submit your questions via the Q&A box, and we'll do our best to get to all of your questions in just a little bit. Okay, excellent. So our first question is for all three of you, but why don't we start with Jack? So the question is, we know that work-related musculoskeletal disorders are multifactorial in nature. Physical components, psychosocial risk factors, organizational risk factors. So with that in mind, how could the total worker health framework help an employer prevent injuries, specifically musculoskeletal injuries? And if you have any examples to share, that would be fantastic.
Great. And my lights just went off because I've been standing still so well. Thanks for having me, and thanks for inviting me to be part of this panel today. It's an honor to be here. I think, from my point of view, I come into total worker health as an ergonomist, is trained as in ergonomics and doing research in that area. But it gets back to something that Alysha said earlier, and it's about systems. And it's really that total worker health takes, just like ergonomics, I would add the word human systems and really start thinking about the fact that we're managing human systems. And when we think about ergonomics, it goes beyond the physical and really thinks about also the idea of this, the human factors side of a workforce and the human systems in general. So there's a lot of parallels between total worker health and ergonomics. In fact, many of the original sets of centers across the country were founded by people who had strong ergonomics background. I think of Martin Cherniak and Laura Panett at CPH-NU, the Center for Protecting Workers of New England. I forget the exact full acronym at UMass Lowell and UConn. They came at it from that point of view. I like to think that the total worker health, from our point of view, from the center at Harvard, our point of view about total worker health is really trying to change the conditions of work, because it really gets back to this idea that the humans, we talk about fitting the job to the human, but it's also understanding human behavior is often responding to the conditions of work. And when we think about overexertion injuries and the MSDs that Alysha spoke about, those are often related a lot to the environment and understanding the whole environment. And often we've seen this when we look at intervention studies for for MSDs, that often multifactorial programs are a little bit more effective, especially when participatory approaches are used in an effective way. And I mean that it's participation of all levels of the organization. It's not just asking the workers what should be changed, but actually making sure that the organization creates changes. And I think that's part of the emphasis of total worker health, is getting back to making sure the organizational change occurs so that the conditions of work that impact the psychosocial, the physical, and the organizational factors all are impacted together, and that creates a different conditions of work that impact not only musculoskeletal disorders but mental health and other related, and cardiovascular disease and a lot of other non-communicable diseases that workers suffer due to their work.
Great. Well, thank you so much, Jack. So I'm going to move to Emily now, but I'm going to repeat the question just to help you out here. So again, recognizing that work-related musculoskeletal disorders are multifactorial in nature. So how could the total worker health framework help an employer prevent injuries, and specifically if there's any insights around musculoskeletal disorders, and if you have any examples, that would be helpful.
Well, thank you for having me. Dr. Alysha Meyers has provided an excellent introduction. So in my opinion, 3 specific perspectives about total worker health framework can help with injury prevention, especially MSDs. Now, the first is the systems thinking, the systems approach. We know that physical hazards, such as manual material handling, can lead to workplace injuries, such as MSDs. And research has found that personal factors, such as BMI, body mass index, and gender, and psychosocial factors, such as job stress and employee depression, are also factors that affect MSDs. Additionally, these factors can interact to affect MSDs jointly. Mm-hmm. For example, MSDs can potentially be caused by a particular body size combined with poor work postures. It is therefore important to have a systems thinking approach when addressing MSDs. This means that we should not think about just one risk factor in isolation. We need to think about risk factors that can systematically work together to put some workers at even greater risk than others. And second, from the total workers framework, we also learned about not only protecting employees from hazard, but also promoting prevention efforts, like being not only reactive when injuries occur, but also proactive to prevent MSDs. It's very important. Mm-hmm. So as a company, don't wait until many employees suffer from MSDs. Don't wait until disaster occur before willing to make changes. And the third point related to the policy programs and practices of companies in regard to employee safety, health, and well-being. Having appropriate policies and programs is important, but it is equally important to have appropriate practices. So there is sometimes a gap between company policies and local practices. And there are times when the training and the programs offered to employees do not meet their needs. So some specific examples of potential interventions and strategies that can counter the factors that contribute to MSDs are having a leadership that supports safety practices, improving the culture to prioritize pain-free or at least pain-lifting work, reducing job stress and long work hours, and helping employees rest and recover after injury, having healthy return to work policies and practices, and designing work and the work environment in a way that prioritizes safety, health, and well-being, both at work and outside of work. So again, in my opinion, 3 specific perspectives about total worker health framework can help with injury preventions, especially MSDs, include using systems thinking, a systems approach to address MSD, being proactive, not just reactive. And number 3, setting up appropriate policies and programs, but also ensuring that the practices is efficient and effective. Thank you.
That's fantastic. Thank you for all those insights. Thank you, Emily. So Alysha, do you have some more information to add?
Sure. For me, it's about creating a culture that supports overall worker well-being. So that talks about your overall quality of life with respect to your health and work-related environmental and organizational and psychosocial factors. And if you have an overall culture of well-being, then I think your ergonomics program has a place to be more effective. I think you wanted a couple examples on the Total Worker Health, the NIOSH Total Worker Health website. We have some case studies of promising practices. So maybe I can give a couple examples of how comprehensive approach might apply. So one example would be at LL Bean. So LL Bean is an outdoor clothing and equipment company, you probably realize it, based in Maine. And they were experiencing a period of very high turnover because they're such a great place to work that employees become really lifelong staff members. But like many workplaces, their workforce is growing older. So the average age was about 50 when they started their program. And for workers that have really physically demanding jobs, the risk of getting hurt at work can increase with age. And then some people have been in those jobs for decades. So that's cumulative exposure to risk factors that we know can cause injuries and illness. And also with age, you get some reduced flexibility of the neck and spine. Your grip strength might go down, lifting strengths, some limits to your range of motion. And so older workers are also more likely to develop chronic diseases such as arthritis and obesity. And these issues really make focusing on prevention in a holistic way effective. In this example, LL Bean began taking steps to improve their work processes and prevent injury and illnesses for all their workers. So they did take like a systematic approach. They first focused on a high-risk area in their warehouse, so material handling in the warehouse. And they already had a lot of great prevention strategies in place. But most, for example, the workers were usually just assigned to the material handling activities twice a week, and they rotated, every couple of hours, and they got 3 sets of paid 5-minute rest and stretch breaks. So to go beyond these strategies, they started using some new lift assist devices in the warehouses. So the vacuum lifts reduce the weight to less than 5 pounds for material handling. And then they had some pallet positioners that allow the loads to be at optimal height. And in this case study, they didn't have any back injuries that had been reported while using the technology and got really positive worker feedback. And at the same time, they also launched a Jumpstart cardiovascular fitness program. So that program was company-wide. The idea was to reduce risk factors that can lead to chronic disease by having a voluntary conditioning program that benefits the workers on and off the job. So they aimed to improve cardiovascular fitness and have aerobic training and strength training programs at work 3 times a week for 12 weeks with 45 minutes of paid company time during their work shift to participate. And they really saw, great improvements in muscle strength, endurance, and flexibility. And they didn't expect, they weren't planning to have workers lose weight, but 29% of them did lose weight.
Great.
62% had more energy, and 29% reported less stress, and the workers' compensation cases were reduced. So that's kind of one case study example where you can see how they're creating a more holistic culture of well-being.
What a fantastic example. Thank you so much, Alysha. So I'm going to return to Emily. So Emily, you spent most of your research life in the safety climate domain. So there's 2 questions. 1, can you briefly explain what safety climate scale is? And how can an organization's safety culture and safety climate impact work-related injuries? So I'm going to start with that one. Again, can you briefly explain what safety climate scale is? And how can organizations' safety culture and safety climate impact work-related injuries?
Yeah. Safety culture is about the underlying belief and the core value of safety within an organization. It is important for companies to have good safety culture and set safety as a core value of the company. And safety climate is defined as an indicator and measurable aspect of safety culture. So safety climate refers to employees' shared perceptions seeing through employees' eyes of their company's policies, procedures, and practices, and as they related to the value and the true or relative importance of safety within the organization. And leaders create the culture and climate for their companies. So it is not about what you say, it's about what you do. And when there is a competing demand, such as between safety and money, safety versus productivity, safety is still important. And research has consistently shows that safety climate is one of the best leading indicators of organizational safety outcomes to predict future injuries. Safety climate is directly linked to employees' improved safety knowledge and motivation, leading to outcomes such as improved safety performance and to reduce accidents. And my team has published papers based on the social exchange series, in which we established that when companies have good safety culture and climate, the impact goes beyond safety outcomes. We found that when a company have better safety culture and climate, their employees have a higher level of job satisfaction and engagement and have lower turnover rate. So when companies have good safety culture, it shows that employees that they care about them. Employees feel obligated to pay back their company and reciprocate by increased engagement and less intention to leave the company, and they are happier as well. So in terms of how to extend this safety climate scales to the total worker health to prevent injury.
If you could take it to extending that safety climate to the total worker health, that would be fantastic.
Sure, yeah, thank you. So for the second question, there are 40 years of research and practices in safety climate. So the concept, knowledge, and methods can be extended to the concept of total worker health, culture, and climate. So our team defined a total worker health climate to include 3 components: climate for safety, climate for physical health, and climate for well-being. So we anticipate that when companies have good total worker health culture and climate, they will have better safety, health, and well-being outcomes, as well as better employee engagement and a better retention rate. In companies with better total worker health culture and climate, employees will have fewer injuries and fewer MSD as well. So we would like to encourage companies to set total worker health as one of their core values. Yeah, thank you.
Oh, fantastic. Fantastic. Thank you. And thank you for making that connection. So sounds like people, the scale will help people get excited about coming to work every day. So when you score well on those, on that scale. I'd like to return to Jack for this next question, and I'd like to get all 3 of your input on this. But, you know, at NSC, we are always trying to develop resources for all different injuries and industries of all sizes, from small to large. So the first question is, can you share some elements that every organization should consider when they develop a total worker health program for themselves? And then we're going to come back afterwards, after we go through the 3 of you, to talk about highlighting some resources. So if you could focus on the first, some elements that you believe every organization should consider when they develop a total worker health program.
So, well, mine's going to come right out of my resource, or out of one of our resources, which is our implementation. Well, it's actually both of our resources that I've listed that I think you're going to be sharing with folks later. But I think, you know, when you know, and it's been alluded to, in fact, Emily described some of the key elements that the key characteristics of a total worker, or what we often call in our idea, in our center, the integrated approach. And that is, of course, leadership commitment. Without getting and leadership commitment at all levels, not only at the top level, but the middle managers as well, that they're on board with the commitment of this effort and understanding the benefits of it. I've seen a question that really talks about how do you convince them and convince leadership that this is important. I think it comes down to making sure you speak their language. We can come back to that. But making sure that the leadership is committed, on board. I've seen this with our own trials where we've implemented this in workplaces and it's failed when leadership isn't really on board with the whole idea. Secondly, which sort of builds off this, is participation. And it's not just participatory approaches, but it's participation of stakeholders across horizontally, because that's the other thing about total worker health is it really makes us get out of our silos, out of our ergonomic silo, and really understand how different parts of the organization impact this area. So participation of not only horizontally, but vertically within organization of the stakeholders in leadership. Again, policies, programs, and practices that really focus in on positive conditions of work. And that gets tricky because sometimes you have competing, and this is where safety climate comes in, is sometimes you have these competing policies that really sort of give mixed messages to the workers, but really having this consistent focus on creating positive and supportive conditions of work that support, that both protect and promote worker safety, health, and well-being. Again, we've talked about this across the board, comprehensive and collaborative strategies, not just thinking about this one safety lift that we've got to think about, but really how do we integrate this, lifting system into our whole operations and into our priorities, as well as into our maintenance, as well as into our maintenance systems and other types of examples. Adherence, we talked, Alysha talked about this before. We always have to maintain our adherence to both the local and governmental as well as voluntary kind of regulations, and making sure, as well as ethical norms, and making sure that we have a respectful workplace, and really gets to this idea of psychological safety as well. And then finally, which I really love, the example that Alysha had so many of this in it, and that is finally data-driven change. Use data, and it can be qualitative as well as quantitative. Sometimes going and talk. We heard at the Total Worker Health Conference, Douglas Parker talking about, we got to do more listening to workers out there. And I think, that's data, right? But Alysha talked about high-risk zones and really focusing in on those. And I know Dartmouth Hitchcock has used a similar approach in their Total Worker Health in there. So that's my list. I'll stop there and turn it over to somebody else.
Fantastic. I'll turn it over to Alysha.
Sure. So Jack just touched on a lot of the defining elements of the total worker health approach from the NIOSH perspective as well, and demonstrating leadership commitment, and then designing the work to eliminate or reduce hazards, promoting worker engagement throughout the program design and implementation, ensuring confidentiality and privacy of workers. So that might mean if you're going to be collecting health data about workers, you might want to work with a vendor to collect that data. Integrating relevant systems to advance worker well-being. And just like Jack said, creating a cross-functional team where you're gathering people from all different parts of your organization in planning your program. And I know when I first started working in this area, it's a little confusing. What do they mean by integration? So that, it does take a little bit of time to kind of get your mind thinking in a different way. And that's why it helps to look at some examples out there. I think just the participatory approach is really important. So make sure you include labor unions if you have them, and worker representatives. And sometimes the workers' needs, their number one priority is not occupational safety and health, or something related to workplace wellness. They really might need something with their leave and benefits optimized, or better pay, something like that. So total worker health just really includes everything.
Fantastic. Well, thank you, Alysha. And Emily, would you like to answer this question?
Sure. Our Oregon Healthy Workforce Center, which is one of the 10 Total Worker Health Center funded by NIOSH as well, we have a class on Total Worker Health 101. So in this class, we mentioned there are 4 principles of total worker health. The first principle is that leadership, employee engagement, and cultural all affect total worker health. And the number 2 is safety, health, and well-being outcomes intertwine and interact. And the number 3 principle is total worker health affect organizational value and cost. And the last principle is effective total worker health program require evaluation, sustainability, and continuous improvement and confidentiality. And in this case, in this class, We also provide the fundamentals of the 5 elements of total worker health climate, which is listed by NIOSH, which Alysha and Jack just mentioned that include the first element, leadership commitment. Again, that's leaders create a cultural climate. It's very important to demonstrate the leadership commitment to safety and health at all levels. And the number 2, eliminate all the hazard, promote worker well-being. The element 3, as Alysha just mentioned, is promote, support worker engagement, the participatory approach to the program and design and implementation. The element 4, ensure confidentiality and worker privacy. Again, we are talking about employee safety, health, well-being, mental health. So it's important to ensure confidentiality and worker privacy. And the last element, as we all mentioned earlier, is integrate the relevant systems approach to advance worker well-being. Thank you.
Fantastic. So we have just a couple more minutes before we're going to transition to the Q&A from the audience. But I'd like to give each of you the opportunity to highlight a few of the resources that you've shared with the audience. Do you want to go ahead and start, Emily?
Sure. As I share with you, we have a Total Worker Health Center, one of the Oregon Healthy Workforce Center, as one of the 10 center funded by NIOSH. On our website, we share a lot of information. We have 3 great examples, cases of total worker health programs, and can also be found on our website. That's from the Police Department in Bend, Oregon, the City of Eugene, and the Portland Water Bureau, and the Portland Bureau of Transportation. Again, you're welcome to take a look at it. So some key elements in these cases include implement a needs assessment, as we share, to understand the existing levels. So there is a NIOSH Worker Wellbeing Questionnaire, WellBeQ, which is available to do the assessment. And our center has the needs assessment survey we use. In my lab, we use Safety Climate Survey, and my team is currently designing a total worker health climate scale. And the other element include introducing the total worker health related topic to the organizations through a variety of communication channel, formal or informal information sharing. You can find those elements in our cases, offering trainings and workers workshop to employees and manager, redesigning work, provide support such as improving the access to the mental health support and access to employee assistance programs. And actually, I would also like to refer to the total worker health hierarchy of control, which Alysha mentioned earlier, available on the NIOSH website. I think it's very important. These provide a nice framework for organizations to begin examining the harmful factors within the factory environment and the way work is designed, then eliminating them. So when eliminating these harmful factors is not possible, they should find a way to substitute with high risk, to substitute those high risk policy and practices with less harmful one. So that, again, this link from NIOSH provide the guidance on how to use hierarchy. So we have an excellent outreach program at our center, and we invite you to visit our center website and get in touch.
Fantastic, fantastic. Alysha, same questions. Are there a few of your resources that you would like to highlight before we transition?
Sure. Yeah, I want to recognize that we have employers of all different sizes here and at different, spots on the continuum of like whether they're ready, what kind of changes they're able to make, what resources they have to make those changes. So your approach, is going to be different depending on what your situation is. You might want to start with the Let's Get Started section of the Total Worker Health website. And so that would be one thing. I would definitely sign up for the Total Worker Health in Action newsletter as well. And maybe read some of the promising practices, case studies, so that you can have like more concrete examples of how this works. And, I only had a few minutes in my presentation. I neglected to explain the Centers for Excellence. We have 10 academic Centers for Excellence, and they all have wonderful materials. But I realize it can be a little overwhelming when you're just started. So I would start with those.
Fantastic. Well, thank you. And Jack, same question.
Yeah, so I just want to highlight, besides our website for the center, which now has been highlighted several times, is our guidelines for doing the integrated approach or total worker health approach. And it's available on our website to download. It's called Implementing an Integrated Approach, Weaving Worker Health and Safety and Wellbeing into the Fabric of Your Organization. I really like that title because it really gets to the point that what we're talking about here isn't, is that we're breaking down silos of how we do things and really making this part of everybody's job within an organization. The guidelines really talk about the approach. It has a whole section on leadership and collaboration. We've been talking about it a lot, but how do you achieve it? I know that's one of the questions there. And we provide examples in there of making the business case. Goes through a whole planning stage. The total worker health approach, that we talk about systems and stuff like that, it has to be adaptable to the different sizes and the different types of companies and enterprises out there. And it really has to be adaptable. And I think that's one of the great things about our guidelines is that they've been adapted by other folks. Other organizations have been translated to Spanish and it's out there. So, but it talks about planning, then it talks about implementation and also evaluation and improvement. How, this is often what we're talking about in all of this is a continuous improvement model. And that's what's really kind of exciting about total worker health is it usually goes beyond, and we heard that in the case in LL Bean, that it goes beyond just, protecting the worker, but also people get to know, and some of the smaller companies we've worked with, they learn stuff about their organization that they didn't know in the get-go. So that's our primary one that I want to highlight. We also have something called the WISH tool, the Workplace Integrated Safety and Health Assessment tool, which really looks at those 6 characteristics I spoke about before and a way of you measuring that in your own organization to get an overall feel of where your weak and strong points are and how you can improve on that. So those are the 2 resources I would recommend from our website. And we've got a lot of other things. We're actually working on a thriving questionnaire to sort of look at how do we promote workers' values at workplace to make sure that they're thriving and they're doing well and they want to stick around.
Great, great. Well, thank you, Jack, and thank you, Alysha and Emily, for sharing your insights and perspectives. Now we want to transition to hearing from the audience. But first, we're going to share a couple of short questions for you, the audience, through a poll. So if we appreciate you guys, if you could answer those now. So first of all, we'd like to ask you, which stage best describes your company's musculoskeletal disorder solutions plan, your MSD prevention program? If you could share that with us, that would be fantastic. And then secondly, we would like to know about your total worker health initiatives. So which stage best describes your company's work related to total worker health? And each of these are just a single answer, please. So as you're answering these, we do want to let you know that any of the questions that we don't get to, we will share them with the speakers so we can get them answered for you following the session. Excellent. So let's see where we are. So from the MSD prevention or MSD solutions plan, we have some that are just starting. And let's see, the largest percentage, 47%, is that you have some systems in place and eager to implement new ideas. So fantastic. So that's great. And let's check the other answer down here. So related to total worker health, it looks like we have folks that are a little bit earlier in their journey for total worker health, where a lot of them don't have anything or are just learning. So, and just a handful have some systems in place. So fantastic. So that tells us why you're here today. So hopefully you've learned a lot of fantastic information and a lot of nuggets that you can take home and act on. So now we would like to spend a few minutes answering some questions from the audience. The first question that I'd like to ask, and Alysha, Emily, or Jack, any of you can jump in, but it's related to management and engagement. So what approach has been shown to be effective in engaging the management or leadership teams in the desire to implement total worker health? Anyone like to take that one first? Emily, looks like you're ready to share.
I would say I think the securing buy-in from leaders, especially from top management, is one of the key barriers for many organizations. It is important to encourage and convince organization leaders to involve in the total worker health and set the core values. And the other part is the organizational readiness, right? Is relevant to the leadership issue as well. So again, as I shared from the cultural and climate research, we find company often wait until accidents happen. So when disaster happen, those leaders suddenly just jump in to say, we know how important it is now, let's do something. But sometimes it's too late. So I think for me as a researcher, we can provide scientific evidence of the benefits for companies, for leaders when companies really care about employee safety and health and well-being and all the benefits. And again, the impact safety beyond safeties and worker well-being. So I would say convince leaders. As a researcher, I'll share scientific evidence. We'll show case studies to see how important it is. And again, encourage the leaders. Don't wait until accident happen to think they need to do something to change.
Excellent. Thank you, Emily. How about Jack?
Yeah, so the question was framed in terms of what it takes, and that's something, in terms of evidence-based approaches, it's something we're still learning about, and I think some of the centers are really looking at what are some of the barriers and facilitators folks are facing. But what we teach and what some of the best practices are is really making the business case, understanding what's the value added to this approach, to the business model, and to that. And sometimes that requires speaking the language of the C-suite, or and understanding how to speak that language with the C-suite. Something we teach in our class to our safety and health professionals that we train here in Boston. But also just thinking about how to speak that language, but then have them understand the value that this is probably going to also impact their bottom line in some way. And also, one of the things we've been learning from the people we've worked with is that they do understand that this actually improves their organizational efficiency. So those are, it's making those comments that really, those providing that data. And remember the data-driven change of like, what is it, what are MSDs costing us right now? I think a lot of, I know that's what colleagues of mine have done when they've taken projects to our leadership in my organizations and said, hey, this is costing us a lot. We need to do something and to do something around this. And they've gotten the go ahead. So, talking that language.
Excellent. Excellent. Alysha, anything to add?
Yeah, I think that also, I don't think that you would have to make, I've been working in government for 12 years. It's been a while since I've been in the private sector. However, I feel like in government, in the private sector, employee engagement is really important. And I don't think you have to convince the C-suite that employee engagement is important anymore, I hope. I don't know. I'm sure your audience could tell, but I feel like this is one way to increase employee engagement by getting them involved in these programs. And then just use a business case argument and connect that to your company's missions and values statement. I think that might be another way to approach it. But this isn't my area of expertise.
Well, great. Well, thank you. So we have time for one more question. I'll ask that the three of you keep your answers brief, but I'd like to ask a question about the connection or the inclusion of total worker health and the health, safety, and environment management systems. Do you see that total worker health is incorporated into management systems? Should it be? Any comments you have on the connection between those two? Jack, would you like to go first?
Sure. Yeah. So, I sort of said this in the beginning, but the total health, if you think about safety management systems, it's about managing risk, and we often think about risk as the physical hazards. And I think what really total worker health does, and I mentioned this at the ASSP meeting about a year ago, is that it allows the traditional occupational safety and health folks to think more broadly about the psychosocial and organizational factors. And so it goes beyond just the physical and starts thinking about the non-physical factors. And in construction, this is huge. And I don't think, in construction, there's always the focus on the physical, which is so important. But, we see high rates of substance abuse and mental health and other things that are probably related more to the non-physical risk factors, and understanding what those are, and that those non-physicals can even be related to job demands and work intensification as well. And so those are, I think, total worker health helps the safety management systems broaden their perspective and understand also the overall organization and how it impacts, how different parts of the organization can impact safety, the worker safety, health, and well-being.
Okay,
that was short enough.
Great. Any quick additions, Alysha or Emily, about the connection or the inclusion of total worker health in a health safety and environment management system?
Actually, I have a very similar comment from Jack's comments. I think that the safety management system focus on improving the safety in the workplace. And I'm happy to say that total worker health really broaden and extend the safety to physical health, to mental health, to well-being, and also making impact, within work and outside of work. The system thinking, the dynamic expanding from a safety management system to a total worker health focus, a systems approach. That's very important. Yeah, thank you.
So, okay, I think we'll close there. Thank you so much, Jack, Alysha, Emily, and thank you, audience, for your great questions. And again, we will submit the questions that we were unable to get to. We'll submit them to the speakers themselves. So now I'm going to pass it back to Corrine, who will share or highlight some MSD Pledge member resources and talk about some upcoming events. Over to you, Corrine.
Thank you. Thanks so much, Lisa. And thanks to all of you. Huge props. In addition to my gratitude to our panel today, I'd also like to really thank our audience for your questions and your responses to the polls. That really helps direct our efforts. And I also just want to reinforce from reading the questions, you're not alone in this journey, right? We have talented groups of people like the panelists you heard from today and their teams to really make sure you have resources to enable you to more easily integrate these principles into your workplace. So the resources discussed today will be shared in the post-event email that you will receive. And in addition, the MSD Solutions Lab has created some new resources for the Pledge community. The current suite of resources can be found at nsc.org/MSD under our resources section. You could also use the link we've just placed in the chat. In addition to the resources we'll be sharing and what you see online, we'd like to share quickly some upcoming events you may be interested in attending. We'd love to have you join us in Long Beach, California for the Future of EHS event, which is at the end of January 31st through February 2nd. It's a 3-day event dedicated to an open exchange of forward-looking ideas, latest in safety innovations, and EHS leading practices. If you'd like to be on the cusp of change and put the latest strategies to work for your organization, this is a great event to consider. It offers safety professionals leading-edge content in a new unified conference format. We'll have engaging keynote and session speakers, thought-provoking fireside interactive chats, curated breakout sections, and safety technology pavilion experience. So there's a link in the chat for more information. And if you're new to the MSD Pledge community and want to learn more about how you can take advantage of our free tools and training and network with organizations, join us for our next virtual new member orientation on Tuesday, November 15th at 1 p.m. Eastern. You can pre-register for that new member orientation by completing the poll on your screen. We look forward to seeing you at some of our upcoming events. As we wrap up today's session, I'd like to encourage you once again to visit nsc.org/MSD pledge, learn more, sign the pledge, and take advantage of the free tools and resources. Once again, thanks everyone for joining us today. Together, we really are improving workplace safety, reducing MSD risks, and enhancing the well-being of workers around the world. I hope you all have a wonderful day.